Good evening, my name is Daryl. I'm going to be your nurse for today. Can you please tell me your name and your date of birth?
Kelly Shower, 12/30 of 65.
Perfect. And how are you feeling today, Kelly?
I feel fine, thank you.
All right, so what I'm going to do today is a head to toe assessment since we're starting off my shift. Is that all right with you?
All right.
Okay, perfect. So I'm gonna wash my hands. The first part of our assessment will just be checking your cranial nerves. Okay, so there's a couple tests for each one of these that we'll just run through pretty quickly, okay?
All right.
So our first cranial nerve is your olfactory nerve. That's your sense of smell. So I'm gonna have you close your eyes and plug one nostril. Okay, I'm gonna put something in front of your nose. You tell me what you smell.
Candle.
Perfect. Keep your eyes shut. Cover the other nostril. Now tell me what you smell.
Lemon.
Yep. All right, so our second cranial nerve is our optic nerve. And to check that, you can open your eyes now. What I'm going to have you do is cover one eye and you tell me when you see my finger wiggle.
Okay.
Okay?
Now. 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 Now.
Perfect. Cover your other eye, please.
Now. Sorry, now. Now. Now.
Okay. So our next nerves that we are going to check are cranial nerves 3, 4, and 6, which are our ocular motor, trochlear, and abducens. So what we're going to do first is I'm going to just have you follow my finger with your eyes without moving your head.
Okay.
Okay. So now no nystagmus noted, and I'm going to take a quick peek at your eyes. If you can move your glasses for a second. Just going to shine a light across them. Okay, so our pupils are equal and reactive. They're 3 millimeters, they're round, and they react appropriately to light. So our cranial nerve 5 is our trigeminal nerve. So what I'm going to have you do to check that is I'm going to have you clench your teeth. I'm just going to feel these muscles. Okay, perfect. Our muscles are strong on both sides. I'm going to try to open your jaw now. Don't let me, okay? Perfect. Now I'm going to have you close your eyes once again. I have a little piece of cotton and I just want you to tell me when you feel me touching you, okay?
Okay. Now. 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 Now.
Perfect. So our strength is equal bilaterally on our facial muscles. There was no pain when I was palpating, and our jaw movements were all symmetric. So our cranial nerve 7 is our facial nerve. So to test that, I'm going to have you smile for me. Okay, frown. I'm gonna have you close your eyes tight and don't let me open them. Okay, and puff your cheeks out and don't let me push the air out. Perfect. There is no asymmetry of our movement and there's no muscle weakness noted. Our cranial nerve 8 is our acoustic nerve. So I think you'll remember from a previous assessment I did, we did the whisper test. So you will plug one ear like this. I'll stand 1 to 2 feet away from you and say a combination of letters and numbers and you repeat them. Okay?
A5X.
Perfect. And go to the other side and do the same test.
D5C.
Perfect. So our cranial nerves 9 and 10 are glossopharyngeal and our vagus nerves. So to do that, I'm going to test those. I'm going to use a tongue depressor. I'm going to have you say ah, and I'm just going to take a peek inside your mouth, okay? Okay, so I'll be more effective with my light. Sorry, one more time. Our uvula and soft palate rise midline appropriately. And I know that this patient does have a gag reflex from previous assessments. So our cranial nerve 11 is our spinal accessory. So to test that, I will put my hands on your shoulders and you push up against me. Don't let me push them down. Perfect. I will place my palm towards your face and you push into me. Okay. So those muscles are equal and strong bilaterally. There's no weakness noted when we turned our face or when we pushed on our shoulders. Our cranial nerve 12 is our hypoglossal nerve. And earlier when I had her say ah, there were no tremors noted. And I'll just have you repeat 3 words after me. Light, tight, dynamite.
Light, tight, dynamite.
Perfect. So our L's, T's, D's, and N's were all distinct and clear. So our cranial nerves are all grossly intact. So since I already took a look at your eyes, I'm going to take a look in your ears now. So looking at the outside, there's no redness noted, no masses, no swelling. Does this hurt?
Nope.
Okay, and no drainage noted. When we come to the other side, this ear looks symmetrical to the other. No redness, no masses, no lesions noted. Any pain?
No.
Okay, and no drainage noted there either, which is good. Just going to have you say ah one more time. I'm just going to take a look at your gums and your teeth. Okay. Our oral mucosa is moist and pink. Our gums are not bleeding. All of our teeth are intact. So we're going to take a look at our carotid arteries next. Just looking from outside, there's no jugular vein distension noted, no abnormalities on either side. What I'm going to do next is I'm just going to take a listen. Right here to your carotid arteries on your neck. I'll listen to one at a time. So bilaterally, there are no bruits heard. I'm just going to palpate each side individually. Feel nice, strong pulses on both sides. As I've been doing my assessment, I've just been taking a look at the patient's skin. There's no abnormalities noted here. No masses, no lesions. Let me take a look at your legs. There are a few small bruises noted. That's from work, isn't it?
Yes.
All right. Next, we're going to take a listen to our lungs and our heart. Okay? So I'm going to listen on the front first, and then I'll have you follow me while I listen to the back. Take a deep breath in for me. And out. In. And out. In. And out. In. And out. In. And out. And come over here on your side a little bit. In. Out. In, out, in, and out, in. Perfect. Now we're going to listen on the back. Our lung sounds were equal and clear bilaterally. Take a listen. In, and out, in, and out, in. Out, in, and out, out, in, out, in, out, in, out, in, and out, in, and out. So our lung sounds were all clear. Now we're going to percuss, which is what I've done before, where I place my hand on your back and you just feel some tapping motion, okay?
Mm-hmm.
Okay, no dullness or hyperresonance noted. I'm gonna come to the front and do the same thing, okay?
Mhm.
All right, so same as on the back, no dullness or hyperresonance noted. Just gonna take a quick listen to your heart. Listen right here where you can hear our aortic, our pulmonic. Right under your breast right here will be the tricuspid. And then our mitral up here. All right. So for the next part of my assessment, I'm going to take a look at your abdomen or your belly area. So if you could lay down right over here for me. All right, so for this, I'm going to be on your right side. Just by inspecting, I see that there's no bulges, no abnormalities, no masses noted. Just gonna shine light across. Okay, you take a deep breath for me. There's symmetry when she takes a deep breath. I'm just going to take a look at your umbilicus. It is midline and it's inverted as it should be. So that was the inspection part. Now I am going to take a listen. I'm gonna start with our right lower quadrant down here. All right, so our vowel sounds are active in all 4 quadrants. Just going to feel around now. Tell me if you feel any pain with any of this. Okay, so now I'm just going to do what I had done on your chest, on your back, which is called percussion. So I'm just going to take my hand and do the same little tapping motion, okay?
Okay.
So there's no dullness or hyperresonance noted in any of our quadrants, so you can sit back up now. You got it?
Yep.
All right. So we're almost done. And take a seat right back here again. I'm just going to feel your pulses and check your capillary refill.
Okay.
So, oh, sorry,
That's spectral.
some glasses, that would be helpful. I'm gonna feel our brachial pulses are 2+ bilaterally. Check our radial pulses. Those are also 2+ bilaterally. Check our capillary refill on both hands. All right, it's less than 3 seconds. I'm gonna come down and check our pulses in our lower extremity, our post-tibial back here. Those are +2 bilaterally, and our dorsalis pedis right up here, which those are also +2 bilaterally. Check the capillary refill on the toes. Sorry about that. These are also less than 3 seconds. There's no edema or swelling noted, no ulcers, and our extremities are all warm. So, see, I'm gonna test your strength now. I'm gonna have you squeeze my hands. Perfect. I'm gonna go back down here. I'm gonna have you use both feet and press on my hands like you're pressing on a gas pedal. Perfect. Now when I push back, don't let me push. Okay. So I'm going to take a look at your gait or how well you walk. I know we did this last time and you like to keep a close eye on it. Walk to that lamp, and then when you come back, walk on your toes if you can. I know, it seems silly, but our gait is steady and there's nothing wrong with our balance. She had no problem making it to the lamp and back. So the last part of my assessment is I'm just going to check your reflexes, okay? So we're gonna start with your arms, with your bicep reflex. Turn like that. Okay, now do this arm. Okay, check your tricep reflex. So I'm gonna hold your arm like this. Perfect. Okay, now our brachioradialis, which are right in here. So our reflexes are all equal and they're strong, they're appropriate reflexes, they're 2+. I'm going to now do your quadricep reflex, which is also the knee jerk reflex that you see on TV all the time. Okay. All right, so those are both equal and appropriate. And now your Achilles reflex, which is right back here. All right. So Kelly, I'm all finished with my assessment here today. Do you have any questions for me before I go?
Nope.
Okay. Well, you know where to find me and I'll be back soon, okay?
Thank you.